In terms of these progressive neurocognitive diseases of aging that cause dementia, so Alzheimer's is the most common cause and is present in probably 80% of people who have this cluster of cognitive and functional changes. And so we know the most about that disease. We've studied it the most, we've trialed the most treatments. And so we've learned that what is happening in the brain, or at least this is what we know at this point, these changes in the brain called amyloid plaques. It's a protein, not like the proteins we eat, but it's a change in the brain that happens that messes with the brain cells, and that starts happening 20 years before or more before any symptoms of Alzheimer's disease. And so we've learned that from years of research of people who we've different studies around the world, longitudinal observation studies. So they're followed every year. They have brain scans. They probably have cerebrospinal fluid testing, memory tests, mood tests, and then they have found consistently that people who have this amyloid plaque, a group of them then develops the second landmark of Alzheimer's disease, which is tau neurofibrillary tangles, and those appear in the brain closer to when symptoms start. And we don't, somehow they start working together, amyloid and the tau. And then soon after, the symptoms begin. Now, someone who has both elevated amyloid and elevated tau in their brains, and we can now measure that before their symptoms in a research setting, there's a high chance they're going to go on to have the symptoms of Alzheimer's disease. Like, not everyone, but a high percentage of them. And so we're in a position now that we have this long, silent, asymptomatic period that we know of. And how can we find the right risk score where a patient comes into their primary care, they're 55, their thinking is fine, and they get screening tests, not just they get the amyloid test, the tau test, say it's positive. And these aren't really, the tau test isn't readily available yet, I must say. And then they have other factors that show that they're at increased risk, like maybe they have hypertension and diabetes and obesity. So then that person could get on, hopefully in the near future, a treatment that will prevent or significantly slow the onset of the symptoms in their life.